If you're coming into Medicare, whether you're turning 65 or you're retiring, you've probably realized it's incredibly overwhelming. There's so much information out there, and it's hard to kind of sift through it and determine what's really important. Today, I'm going to go through the Medicare and You 2020 guidebook, and I'm going to break down exactly what you need to know coming into Medicare and make it as easy and basic as we can. I'm going to go through this whole guidebook and really highlight what you need to know before you enroll into Medicare. So stay tuned. Hi, I'm Jamie Banner, and I'm the founder of Medicare by Jamie. I'm a licensed insurance agent that works specifically with people enrolling into Medicare, and today I'm going to go over the Medicare and You 2020 guidebook. Now, this is a guidebook that everyone coming into Medicare needs to get their hands on and go through to really understand Medicare coverage. It is pretty long, so grab a drink, grab a snack, because we're going to be here for a while, but this is information that you really need to know before you even begin to do your Medicare applications for Part A and Part B. Before we get started, if you find the information in this video helpful, I'd appreciate it if you give it a thumbs up and subscribe, leave a comment down below, and I post new videos every week on all things related to Medicare. But this one is going to be big, important, like I said, Medicare and You Guidebook 2020. And the first thing you want to do is grab yourself a copy of this book because you're going to want to go through it with me as I touch on each page. And I'll show you exactly where you can get it. You can actually find it available on my website, which is medicarebyjamie.com. So if you go to my website, this is the home page. If you go up towards the top right, you'll see Resource Center. And when you click that, if you click under Guides and Forms, you'll find a ton of free resources I have for you related to Medicare. But the second one right there is the Medicare and You Guidebook 2020. So go ahead and click that, download it. It's a PDF. It's about 120 pages. We're not going to read every single page, but it's important to have it in front of you as we go through this. So let's kind of dive in and just start at the very beginning. This is the Medicare and You Guidebook cover, and this is going to tell you everything you need to know about Part A, Part B, Medicare Supplement plans, Medicare Advantage plans, and Part D drug plans, and break each one down into these small, intricate parts that go into them. So the first thing is get started. So we need to know about when we can do anything related to Medicare, especially if we already have it. So this is for people who've already done their enrollment, and it's going to be the timeline of when you can make changes to your current enrollment. And this is going to be for the annual election period, open enrollment at the beginning of the year, and the general enrollment period. So if you've already got Medicare and you've already got something like a Medicare Advantage plan or a Medicare Part D drug plan, you can change those every year, but only during certain months of the year, during open enrollment, also known as the annual election period, and that's from October 15th to December 7th. So even if you're coming new into Medicare right now, it's important to keep that date in mind, because if you want to make changes to things like that throughout your Medicare lifespan, it's going to be restricted to these certain timelines. So big first part is, what are the parts of Medicare? There's a couple different alphabet letters. It's Part A, it's Part B, Part C, and Part D. The first one is Part A, and this is going to be your hospital coverage. So a good way to think of it is your hospital room and board. So this is going to cover when you're hospitalized, the room you stay in, the food you eat, things that are related to the hospital. Once you leave the hospital, you're going to be under Medicare Part B, which is your medical insurance. So these are doctor's visits, labs, scans, things like that. Also good to know, Part B may come into effect during Part A based on the physicians that come to see you, because those things can sometimes fall under Part B, but we'll talk about that a little bit later. Then you've got Part D. That's your prescription drug plan. So that's going to be any prescriptions you take that you pick up outside of the hospital, outside of your doctor's office, at your local pharmacy, or by mail order is going to fall under Part D. So we talked about Part A, Part B, Part D pretty briefly. And then we go back a little bit to talk about Part C. Because when you first enroll into your Medicare Part B, you've got to make a pretty big decision. You're kind of faced at the road, and you can go left or you can go right. You can go original Medicare or a Medicare Advantage plan, but you cannot do both. So it's important to understand the distinction between the two. With original Medicare, Medicare is still your primary insurer. So you've got Part A, Part B, likely a Medicare Supplement plan, and a Part D prescription drug plan. So in this scenario, your Medigap plan picks up the gaps that are not paid for by Medicare A and B. So Medicare is still your primary insurer and makes the decisions as to what's medically necessary, what's a preventative service, and your Medigap plan approves what Medicare pays and pays the missing amount. On the flip side, a Medicare Advantage plan, you're leaving Medicare, original Medicare, and you're going into this Medicare alternative. So you're now under the custody of a private insurance company. So these plans are likened a lot to HMO plans because they have networks of doctors, they have out-of-network doctors, they have deductibles, out-of-pocket maximums. So Medicare is no longer really your primary insurer. Now you're with a private insurance company and you work with them to find out what they approve for charges, whether you need pre-approval, pre-authorization, referrals, things like that. So it's pretty drastically different from original Medicare. So when we look at these, like I said, there's some significant differences between the two. With original Medicare, you can go to any doctor, any hospital, as long as they take Medicare, you can use them with original Medicare. Same thing with your supplement. If they take Medicare, they take your supplement plan. With Medicare Advantage plans, you typically have a network, so you need to see doctors who are in network. A lot of times you can see doctors out of the network, but you're going to be paying out-of-network charges, and you have to make sure that your plan is going to approve any of the cost whatsoever. With original Medicare, you don't need a referral to go to a doctor. If you have some kind of specialist, doctor you've been seeing, you don't need referrals from your primary to go see that doctor. It's approved under original Medicare as long as it's considered medically necessary. With Advantage plans, you likely need referrals. So you're going to need a referral to see specific specialists and doctors like that. So you're going to have to set up an appointment with your primary in order to go see a specialist. For costs, original Medicare, the way it works is you have your Part A, you have your Part B, but Part B is 80%, so you're left with 20% of charges, as well as a Part A deductible if you are hospitalized. And again, that's why a lot of people pick up what's called a Medicare Supplement plan to supplement what A and B do not cover. With Medicare Advantage plan, your out-of-pocket costs can really vary. Each plan has its own deductible, has its own out-of-pocket maximums, and they can really range on a giant scale to have possibly low premiums, but very high out-of-pocket maximums for the year. So it's important to understand the benefits of those plans as to what you're paying, because with a lot of those plans, you don't pay a lot now, but you definitely pay a lot later. With both plans, you're still paying the Part B premium, and in 2020, that Part B premium is $144.60. So with either plan, you are paying the Part B premium. Original Medicare does not have an additional premium unless you pick up a Medicare Supplement plan or a Part D prescription drug plan. Medicare Advantage plans, some can be zero premiums or they can have higher premiums depending on the benefits of that plan. With original Medicare, there is no yearly limit as to what you're going to spend. So if you just have A and B with no supplement, 20% doesn't seem like that much, but there is no stop to it. So if you have a catastrophic year, your out-of-pocket limit for that year is endless. It can be $10, it can be $10,000. That 20% has no stop. With a Medicare Advantage plan, you likely have an out-of-pocket maximum for the year. Like I said, those really range from plan to plan, so it's important to know what the out-of-pocket maximum is for your specific plan. And then in terms of supplemental coverage, with original Medicare, that's where Medicare supplements kick in. So plans like Plan G and GHD, which I'll talk about a little bit later, those cover that 20% and give you a stop to how much you're going to pay for the year. Same thing with your Part A. If you were hospitalized, there's a deductible. That's what your Medicare supplement does. It stops, gives you a stop for your out-of-year charges, and gives you a little bit more know of how much you're going to be spending a year on that plan. The Medicare Advantage plan, you cannot have a Medicare supplement and Advantage plan at the same time. Like I said, they're conflicting plans, so it's one or the other. Both original Medicare and Medicare Advantage plans must cover services that are medically necessary. The original Medicare, it's covered by Medicare, it's covered by your supplement. Medicare Advantage plans, you need to check your explanation of coverage and see what the coverage levels are for those different services. Both can have a Part D component. With original Medicare, it's a standalone Part D plan. With a Medicare Advantage plan, it can include Part D coverage as well as some other fringe benefits like dental, vision, hearing, but you need to look into the specifics of those coverages. I'll touch on that a little bit later. In terms of pre-approval, original Medicare, you don't have to get pre-approval for services as long as they're medically necessary. with Medicare Advantage plans, you likely do have to get pre-approval for your services from the Advantage plan. And in terms of care outside the U.S., it's going to be emergency care. It's going to depend a lot on your plan. With original Medicare, most supplements cover about 80% of foreign travel emergency. Through Medicare Advantage plan, again, depends on the specifics of that plan. Okay, so now that we've briefly touched on the parts of Medicare, let's talk about how to even sign up for Medicare, because there's a couple different groups that you might fall into, and it's important to know if you're going to be signed up automatically or if you have to do it yourself. So the first group are going to be people who are enrolled automatically. So when you get to 65, if you are already drawing Social Security benefits, or if you're a member of the Railroad Retiree Board and you're drawing benefits, you'll be automatically enrolled in Medicare Part A and Part B when you turn 65. Now, if you're on some other benefits, maybe a spouse's employer benefits, you can defer your Part A and B enrollment, but you have to contact Social Security to defer your enrollment. If not, you'll be automatically put in Medicare Part B and Medicare Part A on the first of the month of your 65th birthday. Another group would be people who are on Medicare disability. So if you've been on Medicare disability for at least 24 months, you will also be automatically enrolled in Medicare Part A and Part B. And if this happens before you turn 65, when you turn 65, you will be enrolled in A and B as a 65-year-old as well. That, of course, is not the case for everyone. Some people have to actually apply for Part A and Part B on their own, and that's going to be the majority of people, whether you want it when you turn 65 or if you want to hold it off because you're still working or your spouse is still working and you're remaining on your employer coverage. So once you decide that it is your time to enroll in Medicare Part A and Part B, you're going to have to sign up on your own. And there's a couple different ways to do this. I've got a video that explains exactly how to sign up for Medicare A and B, and I'm going to link it down below. But really, it's pretty much two options. The first one is going to be your initial enrollment period. So this is the 6-month window around your 65th birthday, so technically 7 months, including the month of your birthday, where you can apply for Medicare Part A and Part B initially. So that's going to take place 3 months before the month of your 65th birthday, the month of your 65th birthday, and 3 months after your birthday. So during this 7-month window, you can initiate your Medicare Part A and Part B if you want it to start when you turn 65. And if you know that you're going to want your Medicare Part A and B the month of your 65th birthday, I say you should apply for it pretty much in that first month of your initial enrollment period, because you're going to want to make sure the application gets processed, you get your Medicare card and number in time to set up all of the other parts of Medicare, because your Medicare number is kind of the golden ticket. That's what you need to set everything else up. So it's important to get that as early as you can if you know you need Medicare to start when you're turning 65. Now, if you're one of those people who kept working or your spouse kept working and you stayed on a private plan with your employer, you're going to be granted what's called a special enrollment period when you do retire and leave that coverage. So when you leave coverage, you've got 6 to 8 months to start your Medicare Part B. And you can pretty much start it the very next month after your group coverage ends. You just have to get a couple special things filled out, mainly an employer verification form. And you can find that form on my website, medicarebyjamie.com. It's a form that your employer will fill out to show that you have had credible health care coverage, which will grant you this special enrollment period so you can start your Medicare immediately with no gaps in your coverage. The other one that might be affected by this is someone who would fall into the general enrollment period. So this would be someone who declined Part A and Part B at 65 but did not have any credible coverage. So you may have been on retiree coverage, COBRA coverage, and never initiated your Part A and B. Unfortunately, Medicare does not consider COBRA or retiree coverage to be credible health coverage. So if you want to leave those and enroll into Medicare Part B, you have to wait until the general enrollment period, which is from January to March of every year, with your Part B coverage starting July 1st. There's no wiggle room on this. You're going to be only starting coverage July 1st. You have no choice, and you're going to likely have a late enrollment penalty into Medicare Part B, and I'll talk about that in just a little bit. So if you're wondering, should you get Part B, it's going to really break down to what is your healthcare coverage now. Like I said, if you're retired already at 65 or you have no coverage, yes, you should do your Part B application because A, you need healthcare coverage, and B, if you don't do it and you wait, you're going to face those late penalties. So even if your COBRA or retiree coverage is great coverage. In the end, when you do eventually leave that and go into Medicare, it's probably not going to be worth the late penalty and the strict guidelines of when you can apply for your Part B to start. Another factor is going to be if you're still working, because a lot of things come into play. So if you're still working, but you work for an employer that has less than 20 employees, and that's kind of hard to figure out. If you work at a small company, you have to kind of get with your employer and figure out who they're claiming, who they're not. It gets a little bit hairy. But if you've got less than 20 employees, things are different. So if you're still working and your employer has more than 20 employees, your group health plan pays first. So you can stay on that group coverage as long as you keep working, as long as you need that coverage for maybe you or a spouse, you can stay and not enroll in Medicare. However, if your employer has less than 20 employees, Medicare pays first. So you have to do your Medicare Part A and Part B enrollment, even if you are staying on that group because maybe your spouse needs it. Medicare is now your primary insurer. So like I said, those are the tricky circumstances where you have to figure out exactly how many employees your boss is claiming, because that's going to factor in as to whether you need to apply for your Medicare A and B or not. So like I said, it gets a little bit tricky if you work for a very small company that may have less than 20 employees. You need to communicate with your boss and figure out if you need to do your Medicare coverage or not. Now we know, do I apply for A and B? What does it cost? If I'm applying for Medicare, I need to know exactly how much my insurance is, especially if I have the option of staying on my group health plan. What's going to be the most cost efficient for me? Medicare Part A, for most people, is free. It is no cost, no premium. There's only one catch. You have to have worked at least 10 years or 40 quarters in order to qualify for premium-free Part A. And also, if you are maybe a stay-at-home spouse, stay-at-home parent, but your partner has worked the 10 years, they will qualify for you as long as they are eligible for Social Security. So they don't have to be collecting their Social Security benefits, but they have to be of age, so 62, in order for you to qualify under them for your premium-free Part A. What if you didn't work 40 quarters? What if you worked 39 quarters or 29 quarters? You're going to pay for your Part A. The most anyone can pay for Part A in 2020 is $458 a month. And that's if you worked 30 or less quarters. So that's pretty significant. That's going to be a big amount. But like I said, most people who have worked the 40 quarters, most everyone, is going to have premium-free Part A. The only real cost with Part A is the Part A deductible, which we'll talk about a little bit later. Part B is a little different though, because Part B does have a premium, and that is for everyone, regardless if you worked 40 quarters or 400 quarters. In 2020, the premium is $144.60, and that's what the majority of people pay. But unlike Part A, it does not matter how long you worked for your Part B premium. It's going to actually depend on how much money you claimed on your most recent tax return that Social Security can get its hands on. So if you claimed that $87,000 or less individually, or $164,000 or less jointly, you're going to pay $144.60 for your Part B. Now, if you claimed higher than that, it goes up in steps, and your Part B premium is going to increase based on what step you fall into. It's good to know that this is not just salary. This is any taxable income. So we're talking estates, inheritance, things like that. So it's important to know exactly how much your Part B is going to cost based on what you claimed. There is a little bit of a loophole if you claimed a lot, because it's usually based on 2 years ago, because it's the most recent tax filing they can get their hands on. So if you made a lot 2 years ago and now your income has substantially changed, like I said, if you retired, your income is going to have substantially changed. You can file an IRMA appeal. And IRMA is going to stand for Income Related Monthly Adjustment Amount. Big mouthful. But what that's saying is you apply for this saying, hey, I made a lot before, I don't make as much now, I can't afford my Part B premiums. And Social Security will assess, and they may adjust your Part B premium based on what they find. So if your Part B premium is raised, but your income level has changed, it's always a great idea to file this appeal. You can find the appeal on my website, Medicare by Jamie. It's just a form you submit to Social Security to have them reassess your IRMA. Other thing is the Part B late enrollment penalty. So this was what I was talking about. If you did not have credible health coverage and you delayed your Part B, like I said, you can only apply during the general enrollment period, and you're going to have a late penalty. And it's going to be a lifetime late penalty. And what it is it is 10% for every 12 months you delayed your Part B, and it's going to be more and more every year. The longer you delay, the bigger your penalty is. So it's something to really factor in if you're thinking about delaying your Medicare Part B, but don't have the credible coverage to waive the penalty. You're going to increase the penalty the longer you delay it. If you're wondering how to pay your Part B premium, it's really a couple ways to do it. First way is if you're drawing Social Security, they're going to pull it right from your Social Security. Pretty much never going to see it. They're going to pull it every month. You don't have to worry about that. If you are not drawing Social Security, they're going to bill you directly for your Part B, and they're not going to send you a monthly bill. They're going to send you a quarterly bill. So every quarter, you'll get a bill for your Part B, and you can pay it a couple ways. You can do Medicare Easy Pay. You can pay it by credit card, debit card, mail in a check if you really want to. A couple different ways to pay it. You just want to make sure you pay it on time. And once you do sign up to receive your Social Security benefits, they'll draw it right from Social Security, and then it's nothing to worry about. It's on them now and not on you. Okay, so now we have Part A and Part B. We did our application. We're in force. What do I get from it? What is Part A and Part B covering? Because that's something you need to know, is what falls under a Medicare approved service. First, we'll talk about Part A. Like I said, that is your hospital coverage. So if you are hospitalized, it's going to be your room and board. It's going to pay for you to sleep in a bed, eat some food, and have some nursing care. So it's going to pay for things like hospice care, home health care. Pretty much when you're inpatient, it's Part A. Good thing to know, really important thing to know, is you have to be inpatient. So if you get an outpatient surgery, even if you are held overnight, you need to make sure it is inpatient if it's falling under Part A. Because if it's considered outpatient, even if it is overnight, it is now Medicare Part B. And even if you are inpatient and you're Medicare Part A, not everything that happens in the hospital is covered under Medicare Part A. If you look at the fine print here, it even says, generally, 80% of Medicare-approved doctor visits while you're in the hospital are covered under Part B. So that's saying that some of the doctors that may come to see you are charging outpatient services even though you're in the hospital, and now these services fall under Part B. Because technically Part A, yes, it's the hospital, but it's really the room and board of the hospital. If a doctor comes to see you, this can be considered an outpatient charge and fall under your Medicare Part B. Also with Medicare Part A, like I said, the premium is free, but there is a deductible. And that deductible is $1,408. And always keep in mind that deductible is not annual. It's not a yearly deductible with Part A. It's per benefit period, which couldn't be more confusing. What that really means is if you are hospitalized and you go more than 60 days between hospitalization and then you're hospitalized again, that deductible resets and you pay it again. So if you had one hospitalization in January, you go all the way to June and you're hospitalized again, although you paid that deductible in January, you're going to pay it in June again. So you could end up paying this Part A deductible multiple times a year if you are super unlucky and get hospitalized with more than 60 days in between. If you're hospitalized again within the 60 days, the first deductible counts to your current visit. But if not, you could pay that multiple times, which is why it's important to get something that covers that Part A deductible, such as a Medicare Supplement plan. Part B is going to be your outpatient, your medical. So if you have doctor's visits, labs, outpatient surgery, procedures, that's going to fall under Medicare Part B. So this is your medically necessary doctors, your preventative services. It happens outside the hospital or sometimes in the hospital. It's considered to be Medicare Part B. And if you're wondering what you pay for Medicare Part B services, you have that monthly premium, that $144.60. Medicare Part B, like I said before, covers 80% of these medical costs, leaving you responsible for 20%. And again, that's the 20% that has no stop, no annual limit. It could be really low if you have a great year, or really devastating if you have a huge year and have a lot of medical costs, because the 20% never ends. And that's where you want to pick up something that's going to help you cover Not only that 20%, but also that Part A $1,400 deductible. And that's what I do. I assist people in finding the best Medicare supplement plans to help you kind of cover some of these costs and limit your out-of-pocket for the year. So you can always give me a call. My number is 833-65-JAMIE, or you can visit my website, medicarebyjamie.com, and I will work with you to find the best supplemental coverage for you to help cover a lot of these costs. So what's not covered under A and B? So what you always want to remember with Medicare, it must be A, medically necessary, or B, a preventative service. If it does not fall under these two categories, it is not covered by Medicare. And Medicare has got some big ones that they say they do not cover, and that's going to be dental, eye, hearing, cosmetic surgery, a lot of chiropractic services, acupuncture, massage therapy. Medicare does not cover these. They're not under original Medicare. Sometimes you can find an Advantage plan that might cover some of these. Usually the coverage is pretty limited. Or you can get standalone plans with higher coverage, especially for dental, vision, hearing. A lot of standalone plans go along with your Medicare supplement so you can cover all of your bases, because Medicare does not consider these to be medically necessary as much as we would like them to. So when we talk about original Medicare, this is Medicare A and B, not the Medicare Advantage plan. It's very, very different. This is kind of where Medicare was originally intended to go, hence why it's called original Medicare. So from this, you've got a lot of freedom. You can see any doctor who takes Medicare because you have no networks under original Medicare. So you can see any specialist you want. You can fly to New York, Massachusetts, California to see certain doctors. As long as they take Medicare, you can use them with original Medicare. Fortunately, prescription drugs are not covered, but you can get a standalone drug plan to go with your original Medicare. It's called Part D. So a prescription drug plan can go with your original Medicare. So you have A, B, a supplement, and Part D. Those are always based on the prescriptions you take, whether you get a Part D or with an Advantage plan. The prices vary based on your prescriptions. You do not have to choose a primary doctor under original Medicare, except you can jump around and see whatever doctor you want as long as they take Medicare. You don't need a referral to see a specialist. Some specialists might maybe require you to get a referral so you're not just going to a cardiologist randomly because you want to go see a cardiologist. But Medicare does not require you to have a referral to approve these charges as long as they're deemed medically necessary. And with original Medicare, like I said, most people get a Medicare supplement plan because Part A has a high deductible and Part B has that 20% that's not covered. So a Medicare supplement is what covers you on these charges. So you have full coverage without getting a ton of doctor's bills to your house, because that's not something we want to deal with when we're retired, is getting bills from doctors and doctors. We want to know we pay a monthly premium and everything is taken care of. So with your original Medicare, your out-of-pocket costs, like I said, it really depends on whether you pick up your supplement. But with the supplement, it's very, very limited. In the year 2020, there are no Medicare supplements that can cover your Part B deductible, but that deductible is only $198, so it's not anything significantly high to look at. So you've got out-of-pocket of a Part B $198 deductible, and then with a lot of plans, you're fully set for the year. You don't have to worry about any charges coming your way. The only thing you really need to think about is something called Medicare assignment, and really, for a lot of plans, you don't even have to think about it, because it doesn't come up very often. The plan it most often comes up in is a supplement plan N. So when doctors are considered participating providers in Medicare, they're given the option to accept something called Medicare assignment. And what that means is they are accepting the Medicare approved amount as payment in full for their services. Some doctors don't accept this payment, therefore they don't accept Medicare assignment. It's very low. The statistic says it's anywhere from 93 to 97% of doctors do accept Medicare assignment, but that leaves you with maybe, 3 to 4% who do not accept assignment. And if they don't, you could be responsible for paying up to 15% of the Medicare approved charge. Honestly, is it likely you'll run into someone who doesn't accept assignment? No. Is it possible? Yes, but there's a lot of ways to verify this before you make the doc's appointment. You can check the Medicare provider search. I have a link, planndoctors.com. If you go there and type your doctor's name in, if they have a green check mark, they accept assignment. If they have a yellow question mark, it means they may or may not, and you should clarify with the office directly. Or you can just call the office and make sure you ask if they take Medicare Assignment, not Medicare Advantage, because sometimes there's confusion, but Medicare Assignment. And then you'll know if an excess charge is possible. Other than that, there are 8 states that do not allow excess charges to happen. But if you live in one of the other 52 states, something quick and easy to verify beforehand. And if your doctor does not take assignment and you really love that doctor, you just know that you may pay 15% of the Medicare approved charge. So not 15% of whatever the doctor wants to charge, 15% of the Medicare approved charge. So again, likely no, possible yes. When we talk about Medicare Advantage plans, we're kind of night and day. We're flipping the script because these are very different plans. These are leaving original Medicare to go under a private insurer as pretty much your primary. So these plans, like I said, you've got HMOs, PPOs, these kind of structured group plans have got a lot more rules than original Medicare and a Medicare supplement plan. So you still have A and B, you still pay for Medicare Part B monthly premium, but now you've also got this Advantage plan that may have a $0 premium or may have a higher premium. And usually the higher the premium, the better the plan, but that's not always the case. It really depends on the plan specifics and the coverage levels. So if you're in a Medicare Advantage plan, you're now working with things like networks of doctors, referrals for specialists. You can have out-of-network charges. You're going to have deductibles, out-of-pocket maximums. It's probably very similar to maybe a group plan you've left before. It's really structured, but it's not, again, the freedom of original Medicare with the supplement plan. These plans can also offer extra benefits. So like we talked about before, original Medicare does not cover vision, hearing, dental. These can be covered on their Advantage plans, but don't get too excited because it may not be very high coverage. You know, most dental, it's going to be 2 cleanings a year, not covering anything really thorough on dental. So you want to, just because they say hearing, vision, and dental may not be very good hearing, vision, and dental. So you need to look at, again, the plan specifics and see how much of it they cover. And is it really worth it to go into this plan when you can just get a standalone plan that aren't terribly expensive? Medicare Advantage plans do have to follow Medicare's rules, and they do have to approve things that are medically necessary and preventative. But again, there's levels of coverage and amounts that they will approve compared to maybe just original Medicare. So with the Medicare Advantage plan, if you're wondering what you pay, like I said, you still got your Part B premium. You may have a monthly premium for the Medicare Advantage plan. You've got a deductible. You've got an out-of-pocket maximum. You'll pay for things like drug plans if you add them on. So they seem less expensive sometimes, but really, I like to say with Medicare Advantage plans, you pay later. Medicare supplement plans, you pay now. You pay now, you pay later. You're going to pay one way, but I like the freedom of original Medicare with a supplement plan. I like knowing I can see whatever doctor I want, pay up front, split it out on a monthly basis rather than having a one big bill come to my house at the end. Last thing with Medicare Advantage plans, a lot of times you do need to get pre-authorization or approval for services. You have to apply before you go see the doctor, before you buy the supply, before you get anything. It's called the organization determination. So you have to make sure your plan's going to approve it before you go forward with a service or anything like that. When can you switch an Advantage plan? So this gets a little bit tricky. During the annual election period every year from October 15th to December 7th, you can enroll in an Advantage plan, drop your Advantage plan, or switch your plan. Same thing with prescription drug plans. You can enroll in a Part D, drop a Part D, or switch a Part D. But that doesn't mean you can just jump into a Medicare supplement plan. Although Medicare Advantage plans do not require underwriting and you can switch from one to the other without having to look at your health history, with a Medicare supplement plan, you have to get approved through medical underwriting if you were out of your initial enrollment period. So when your Part B starts, you've got 6 months to enroll in a Medicare supplement plan with no health history required. They cannot deny you. They have no choice. They must accept you. However, if you want to enroll in one later, maybe you went into an Advantage plan for 2 years, decided, you know what, it's not for me, I want a supplement now, you have to go through medical underwriting. So you have to be pretty generally healthy to get approved because the insurance company has their own criteria and they can deny you for certain medical conditions, medications, kind of whatever they want. It's now on their terms. But with Advantage plans, during the open enrollment period, you can switch those plans around if you want, switch your drug plans around. But to go into a supplement, you can change a supplement any month of the year if you already have one. You just have to be able to pass medical underwriting. That's always the one catch. So when we talk about Medicare supplement plans, that would be if we had chosen original Medicare and now we need a supplement to catch the cost the original Medicare did not do. Again, this is what I do. You can always call me, 833-65-JAMIE. Medicare supplements, pretty easy to understand. The plans are all standardized. They're all regulated on a state level and a federal level, which means that each plan is lettered, and that plan is the same amongst any insurance carrier that offers it. The Plan G is the Plan G no matter what plan. They are standardized. It makes it very easy to choose from. So these are the 11 Medicare supplement plans, and now you see 10, but there's a little asterisk which makes it 11. Got a video where I go very in depth on the main plans to choose from, and I'm going to link that down below. Talk about the benefits of each plan as well as the coverage levels. Don't want to get too much into it here because it's going to take me at least half an hour to go through all those. So I'm going to link it down below, but I've already broken it down into what plans really suit what needs. Medicare supplement plans, you have to have A and B. You will have a monthly premium for your supplement plan, and they do not cover Part D. So you likely will have a standalone drug plan, which is your Medicare Part D. And what you want to know about Medicare Part D is they are not required. You don't have to have one. But same thing as that Part B. If you do not get it now and you want one later, you're looking at a late enrollment penalty. So you will have a penalty based on how long you delayed your drug plan, and you can also only get it during the open enrollment period. So that October 15th to December 7th timeline is when you can change your Part D or pick up a Part D. You can't do it any month of the year if you didn't have one before or you didn't have credible health coverage like when you were coming off an employer. If you started your Part B, didn't get a Part D, and now you want one, you have to wait until open enrollment, and that plan is not going to take effect until January 1st. That's something to really think about. And that Part D late enrollment penalty, it's hard to calculate because it is based on how long you delayed and what the average drug cost of that year is, which is going to change from year to year. But what you want to know is the longer you delay, the higher that penalty becomes. So if you delay it for 2 years, it's not a big deal. If you delay it for 20 years, it's going to be a little bigger of a deal because it's not a one-time late penalty. It is a lifetime late penalty. It's going to be tacked on to your monthly premium every month as long as you have that Part D drug plan. So it can get pretty steep if you've delayed it for a long time. But sometimes if you're not taking any medications, it might be something to think about and consider. So those are the main points of this Medicare and You 2020 guidebook. Like I said, we touched on what Part A covers and costs, what Part B covers and costs, how these supplements and advantage plans work, and the importance of a Part D plan. If you have any questions, you can always call me. Again, my number is 833-65-JAMIE. Visit my website, medicarebyjamie.com. It's where you'll find a free copy of this Medicare and You 2020 guidebook. You'll also find those other forms I talked about, like the employer coverage form, the IRMA appeal form, and you can also request a free Medicare supplement quote. There's no cost to you. If I assist you with your Medicare supplement plan, it is totally free. I will go over all of your options for you and help you enroll and get everything set up so you have nothing to worry about. Leave all the worrying to me. Again, if you have any questions, please just shoot me an email, jamie@medicarebyjamie.com. And if you found this nice long video helpful, please give it a thumbs up and subscribe. Leave a comment down below. I post new videos every week, so there's always new Medicare content coming at you. If you have any questions, you can put it in the comments. I will always respond. Thank you so much for watching.